eyeball has three coats. Coats.
Chords?
Understand? Fibrous cord, muscular cord, nervous cord.
Fibrous, muscular, nervous,
Fibrous, muscular,
muscular, vascular.
and nervous. Understand? It is something like a globe. 5th, 6th is sclera, 1/6 is cornea. Understand? 5th, 6th is white, sclera, and 1/6 is cornea. But they are not congruent. The curvature of the sclera is not congruent with the curvature of the cornea. Cornea has more curvature. Understand? And that is inner side is known as the sclerocorneal junction. Sclerocorneal junction. Now, here you can see on the sclera, it gives a protection and it gives a basis. And it gives the attachment to the different muscles around it, and it gives attachment to the gland. Lacrimal gland is placed on the lateral side. Understand? And on the posterior aspect, you can see there is a curve through which emerges the optic nerve. Optic nerve doesn't enter. It emerges. Understand? And around the optic nerve you can find there are some multiple perforations. These perforations are called lamina cribrosa. Lamina cribrosa. Cribriform plate, cribriform fossa, the same, multiply perforated. And what structure pass through it? Through the lamina cribrosa, what structure pass through? Short ciliary nerves, long ciliary nerves, and arteries. Understand? Short and long ciliary nerves and arteries, they pass through the around the optic nerve foramen. Around the optic nerve foramen. Those are called the lamina cribrosa. And this is a very weak spot of the eye. So when there is a glaucoma, the pressure of the eye increase, this might herniate out. This might herniate out. Understand? This region is weak. And what exactly is the point where, look here, it is in the posterior pole. Is it in the, that opening of the optic nerve is in the posterior pole or not? Yes or no? Yes.
Yes.
It is medial or lateral?
Medial.
Medial. How much medial?
5 degrees.
Sir? 35 what? Huh?
Degrees.
Degree. Right.
Units.
How much?
The angle?
It is actually medially. And how much medial? From the posterior pole, it is 3 millimeter medial. Understand? 3 millimeter medial. So what exactly lies in the posterior pole then? Fovea. Around the fovea, macula lutea. In the posterior pole, there is a macula lutea. In the nervous cord. Macula lutea means macula of the eye. And in its center, you can find there is a fovea. Fovea centralis. Should I repeat? So what exactly lies in the posterior pole? Macula lutea. In its center you can find what cells you find in the fovea centrum? What cells? Cones. Understand? There is a high population of cones. Sure, you are looking at distant area, but you want to focus. Particular area you want to focus. That is called
Accommodation.
say,
Accommodation.
huh?
Is it accommodation?
Accommodation will come into it. It is actually
Focus.
focal point. Focal point is also like that, but it is.
Closing the iris to focus the light on the fovea.
So this is a cone which actually demarcates that. Suppose you are from a rooftop, you are seeing a crowd, and you want to focus a particular person. So that is also being done by the fovea centralis by its cones. That is called acuity of vision. Acuity of vision. Understand? Okay. Now we are coming into the. We are returning back into the. And what are all these things?
Vessels.
Ligaments. What is this color? Blue. These are venae vorticose. Vorticose veins. Understand? These are called venae vorticose. Venae. Your vorticose. Your vorticose. Vorticose. And this will ultimately drain into superior and inferior ophthalmic veins. Understand? Good. This is all about the sclera. Now, anybody has any watch? No watch. Nobody has no watch. Here you can see this one is the sclera. This one is the sclera, and this glass is the cornea. And there is a notch in the sclera where the cornea is fitted. Similar thing here. Similar thing also here. There is a notch, and into which the cornea is being placed inside. Understand my part? And you can see because of this notch, a little bit of this sclera is going anteriorly, going superiorly, so that the cornea can fit inside, so that it will not, the glass will not come out. Similar cases. Understand? You can see the notch where the cornea is fitted. So that is called the sclerocorneal junction. Sclerocorneal junction. And in the sclerocorneal junction, we find there is a canal. There is a canal. What is the name of that canal? Canal of Slane. Canal of Slane, whatever it is. S-C-H, Slam. Canal of Slam. What is the spelling?
S-C-H-L-E-M-M.
S-C-H-L-E-M. Canal of Slam. Understand? Or it is a circular canal existing in the sclerocorneal junction. Circular canal. Now you tell me what are the layers of the cornea?
Cornea?
Oh, what's that?
This question will come in your exam. Layers of cornea. How many fingers?
5.
The main substance or the proper substance of the cornea is called substantia propria. The proper substance, the main thickness, is called substantia propria.
Substantia propria.
It has got a outer membrane, it has got an inner membrane. Outer membrane is called Bowman's membrane. Inner membrane is called Descemet membrane.
Which one? Bowman's Descemet.
Understand? Outer side there is a stratified squamous epithelium or the conjunctival epithelium. Stratified squamous epithelium, which is known as the conjunctival epithelium. And inside is the endothelium. Again, what are the layers? Proper substance or substantia propria. It has got two membranes, outside
Bowman's
Bowman,
membrane.
and inside Descemet membrane. DSCEMET. Descemet.
Bowman's
Externally,
stratified squamous.
stratified squamous conjunctival. Inside endothelium. Remember, this question will come in your histology exam. Understand? Now, that Descemet membrane is very important. From the cornea, it goes into a notch. You can see that sclera is having two notches, one outside notch and one inside notch. Inside notch. What is the name of the inside notch? The inside notch is called a scleral spur. Scleral spur. That Descemet membrane comes and attaches to the scleral spur, enclosing the canal of Schlemm outside. Below the canal of Schlemm, it comes and attaches to the scleral spur. And while attaching, that Descemet membrane makes a network. And through this network, it has got some pore. You see that pore has some predetermined diameter. And through this way, the aqueous humor passes and drains into the canal of Schlemm. If there is this foramen, if you close it, there is a danger. What is the danger? Glaucoma. And if there is a closer, if you become a ophthalmic surgeon, you have to artificially open it. You understand? We don't have good models, otherwise we could have shown. Understand? So this sclerocorneal junction is also a very important junctional point, and that is the point where you can find the canal of Schlemm and the spaces of Fontana. What is this space?
Space of
Fontana.
Fontana.
And this Fontana spaces is blocked. And what is the danger? Glaucoma. It may be of two types, wide angle, close angle. Anyway, so that is all about the fibrous. Till now I am speaking about fibrous. Now I am going to speak on the vascular. Choroid, ciliary body, iris diaphragm. Say choroid, ciliary body, iris diaphragm. That is a vascular bone. From here to here, from posterior part down to the here, it's called the choroid. And you can see some ciliary body. These are ciliary body. And from the ciliary body at its anterior aspect, you can find there is a diaphragm.
Iris diaphragm.
Iris diaphragm, and through it there is a central aperture, which is called pupil.
Pupil.
Now look into other side. You can see there is a iris diaphragm. Iris diaphragm. You can see it on other side. And look into it. There is a dark colored central pupil that also increase in diameter, decrease in diameter by some muscles. Dilator pupil, constrictor pupil, dilator pupil, constrictor pupil. Understand? So iris diaphragm contains the central canal. It is called pupil, and around it there is a circular fibers known as constrictor pupil, and there are some radiating fibers. Those are called
Dilator.
dilator pupil. Constrictor fibers are supplied by parasympathetic, and dilators are supplied by
Sympathetic.
understand? Similarly, in the ciliary body, there are some muscles. Those are called the ciliary muscles. And ciliary muscles are also constrictors and dilators. So their main function from the peripheral margin, from this peripheral margin of the ciliary body, there are some ligaments are attached. There are some ligaments are attached, and in the central region, just behind the pupil, there is a lens. There is a lens, and this thickness of the lens is being controlled by the ciliary muscles. Understand my point? So from this peripheral margin of the ciliary body, you can see ciliary processes. You can see ciliary processes. And from the peripheral margin, you can see there are some ligaments are attached. Many ligaments are there, and they are attached at the peripheral margin of the lens. So sometimes these ligaments contract, so lens thinned out. Sometimes these ligaments loosen, it is thickened out. So that thinness and thickness causes one work. What is the name of that work? Accommodation. Suppose I am looking very close. My lens is convex. Now I am looking distantly.
It's more
Flattened out. No convex, concave. It is thin and thick. And this is called accommodation. Understand? Now, our lens is concavo-convex, biconvex, or plano-convex. Say
biconvex.
biconvex. What type? What type?
What times? 6 months. 6 months?
When you are looking closely, biconvex. But most of the time we are looking distantly.
The default is
It is plano-convex. Understand? So that plane surface is posteriorly or anteriorly? Plane portion is posteriorly. You? Plane is anteriorly. Is correct. But you are also correct when you are looking close, that the anterior surface becomes convex. But when most of the time we look in the distantly, so it is plane. Understand? Now, this ciliary body is a very complex structure. It has got many glands, serous glands, and that always secrete water. That always secrete water. And this vacant space is being covered by one jelly-like structure, surrounded by a membrane. So, what is the name of that jelly-like structure? Vitreous membrane. And what is the membrane? This you cannot see. Go on, tell me. The vitreous humus is within a membrane, hyoid. Understand? And it has a canal inside, hyoid canal. Understand? So, ciliary body, it secretes water. Now look very minutely here. Here is a glass. That glass is called cornea. Then here is the vitreous body. Then here is the iris membrane. So in the posterior part of the iris membrane, the ciliary body is secreting water, and there is a ligament, suspensory ligament of the lens. So in between the suspensory ligament, the lens, and the lens itself, lens, suspensory ligament, and ciliary body, that makes a membrane. Then in its anterior aspect, there is the iris diaphragm. So there is a space. In between them, there is a space. Then in front of the iris diaphragm, there is a space, and then comes the cornea. So you can see from the lens, ligament of the suspensory ligament of the lens, and the ciliary body, that makes a membrane. And anteriorly, there is a cornea. In between them, that iris diaphragm. So in that way, you can make two spaces: posterior space, posterior chamber, anterior chamber. Understand? So what lies within this chamber? Aqueous fluid, secreted by ciliary glands of the ciliary. Understand? So ciliary body, they are secreting, but that water is absorbed. What is that water getting absorbed? Canal of Schley. Canal of Schley. But before going, it is getting filtered by the plexiform layer of the basement membrane, and it is passing through the foramen or spaces of frontal. You understand? So you will have a question. Write the water circulation, aqueous fluid circulation. Where from it originates, how it passes, where it drains. Now what do you understand by the term iridocorneal angle? Iridocorneal angle. And there is a big term, there is a very important term, where lies the canal of Schley. Iris and the cornea, in between them there is angle. So in that angle you search for the canal of Schley, and that is the place where most of the water is drained. After that, it will pass into the veni verticos and then into the superior inferior ophthalmic veins. Anything goes in your head? No?
After some practice.
Okay, give me, what is this book? Is there any eye model picture is there? Find out the eye model picture. Please look into it. Hello? Come here. Here you see, this is lens. This one is lens. This one is the ciliary body, and from its anterior aspect is the iris diaphragm. Understand? These are the suspensory ligaments of the lens. These are the different iris muscles, and from here these are the ciliary process. So this is the posterior chamber, and this one is the anterior chamber. This is cornea, this is iris diaphragm. So what is the name of this angle?
Corneal.
Iridocorneal angle. And what is that canal here? Canal of Schlein. So that water is drained, water is secreting from the ciliary body, goes into the posterior chamber, then comes to the pupil into the anterior chamber, goes into the iridocorneal angle and drained into the ciliary body. Understand?
Yes.
So there are some bigger picture in the book. So you should see particularly this area. You have to enlarge and get yourself clear. Understand? Next we are coming into the internal cord. Fibrous, vascular, nervous. What is the name of the nervous cord? Retina. What is the name of the nervous cord? Retina. Retina, I told you that it has this. Now, this is the light path going, and it hits. Where it hits?
Macula.
Macula limpia. And in the central part there is a depression. Fovea central. And it goes more or less more than half and ends anteriorly in a wavy line. Ends anteriorly in a wavy line. That wavy line is looking like a teeth. Ura serratum. What is the name? Ura serratum. Serrated margin as in like a mouth with teeth.
Okay.
Ura serratum. And what are the layers? The point where the optic nerve goes out, that is the point where that is a blind spot as well as one artery enters.
Central artery of the retina. Central
And it
artery.
divides into upper branch and lower branch, and that area is very important. When you go to the clinicals, you have to buy one retinoscope and you have to see the different arterial. This area is called the fundus of the eye. That blind spot, whatever it says, is called the fundus of the eye, and you have to look into the fundus. And there are many diseases, particularly in the diabetes, particularly in the hypertension. Those areas become blurry. Understand? The artery may be dilated, artery may be more wrinkly, there may be hemorrhage, there may be some bleeding over there. So that is very important. And you can see the arteries that do shown here. Central artery of retina. And what are the layers of the retina? 10 layers or 12 layers. 10 to 12. So today we will go to the histology book and find out how many layers. And you have to read it. Understand? Okay, so what is this? What is this whole thing? Retina. What is that?
Ciliary body.
Choroid
Oh.
and ciliary body. Ciliary body is posteriorly is black color,
Okay.
and this protrusion is the ciliary body, and these are the ciliary processes. You can see ciliary processes. Iris diaphragm is hanging from here, but it is not being shown here. Iris is not being shown here. Understand? Okay.